Yeah. Okay. Okay, dear.
We are live now, ma'am.
Saiti, are we live?
Yes, Monica.
Good evening, everyone. Welcome back to the Icons in Conversation with Dr. Ritu. And today our topic is diabetes. Can we reverse it? And I welcome Dr. M.K. Taneja, sir, MBBS, MS, ENT, MA Yoga, PhD, Brahmari Pranayam. He is a founder and chief Indian Institute of Yoga and Naturopathy. And I welcome Dr. Ritu Santwani, ma'am. She is an MBBS, MD, FICOG, FIAOG, MRCOG, obstetric and gynecology IVS specialist, founder and CEO 360 Degrees Healthcare Studio in Inamdar Multi-Speciality Hospital, Pune, infertility specialist, NUHS Singapore. She's a co-founder, MAM board member of SWWC. I welcome you, ma'am. I hand over this.
Yeah. Yeah. Thank you. Thank you, Monica. Warm welcome, dear sir. Warm welcome to all the delegates who have joined all across the geography. Sir is a very renowned figure. Sir, a very, very warm welcome. Sir, I have found these roses to welcome you. Sir, you and madam are always there to help each and every one of us. So friends, as all of you are aware, now India has become the diabetes capital. So each and everyone is having a lot of queries, whether we are doing the obs-gynac practice or whether we are doing the general practice, or if you are doing the ENT practice or you are doing some other specialty practice. Each and every practice doctor is getting the patients who is suffering from the diabetes. So a very important query in each and everybody's minds, is it possible that can we reverse the diabetes? What's the role of the diet? As our Indian diet is rich in the lot of herbs, lot of plants are available, Karela, Neem, Tulsi. And so lot of patients are having the lot of queries related to that. Ma'am, is the Tulsi arc is good? Is the Neem capsules are good? Is the, what about this Karela? How can we take? And what about that combinations? Lot of combinations are also available. Will after taking these drugs, my H1ABC level goes down? Is it like that, that I will be completely free from the drugs? So to discuss this important topic today, we are having none other than Dr. Mahendra Kumar Taneja sir is with us. First, let me give some more information about the sir, because Monica had given the very short introduction for such a stalwart. First of all, sir, I am really very, very thankful for accepting the invitation and for enlightening all of us with your immense knowledge. I know sir's schedule is very, very hectic, but really grateful to sir that sir has accepted our invitation in such a short notice. Friends, sir has written more than 75 research papers, and sir is in the governing body Ministry of the Ayush Government of India. Sir is the Editor General of the Otology. Sir is the National President of the Association of the Otolaryngologists of India 2011 to 2013. Secretary General for SARC ENT Association 2014. So a very, very warm welcome to you once again, sir. Sir, if madam is there, I want to welcome madam also, Tarni Taneja madam. Madam and sir both are very, very, I can say a fantabulous couple who is an inspiration for a lot of us. So a very, very warm welcome to you, sir. And sir, I'm handing over the dais to all over you. Sir, a lot of doctors have joined all across the geography. Already I'm getting a lot of messages on the YouTube. Some doctors are waiting to hear you from the KRIO, some from the KSA, and some from the Iraq. Yeah, warm welcome. And sir, from Bangladesh too. Yeah.
Thank you, Dr. Ritu. It is a pleasure and an honor to be associated with you and to understand diabetes. Can we reverse it? First, we have to understand the etiology. If we can understand the etiology and the causative factor, only then we can understand. Though the majority of the cases, 90% are type 2 diabetes, and type 1 leads genetic counseling, stem cell therapy, pancreatic replacement, and a majority are type 2. Hence, I will be talking mainly about type 2 diabetes mellitus, which we can reverse diabetes has got two etiological factors. Number one is reduced insulin secretion from the pancreas. Second is tissue insulin resistance. And both of they are interrelated, and I'll explain them how it happens. If insulin is less, there is hyperglycemia. This hyperglycemia leads to insulin resistance. And why diabetes treatment is important? As Dr. Ritu said, it's going to be world capital. The incidence has increased due to aging, due to enhanced lifespan. The incidence has gone 4 times. And there has been roughly 4.2 million deaths in 2019, and the incidence of diabetes mellitus will be 700 millions by 2045. And it is one of the most leading cause of coronary artery disease. The key factor for etiology are patient being obese, predominantly in the abdominal region. What we say in the north, अगर पेट हो गया मटका तो समझो पड़ गया झटका. And the second etiological factor, which we do not talk usually, the abdominal obesity leads to insulin resistance through various inflammatory mechanisms. That is release of free fatty acid and adipokine dysregulation. I repeat, adipokine dysregulation is the principal cause of diabetes, and my whole talk will be depending on adipokine dysregulation at place of working of pancreas. And for this, key factors are lifestyle, genetic predisposition, gut dysbiosis. I repeat, gut dysbiosis and epigenetic. And what is important? Diabetes is a disease of glucose metabolism. Hence, if your metabolism, if your mitochondria is the powerhouse, this disease is basically of mitochondria, and it is due to mitochondrial dysregulation, and we have to act only on the mitochondria to get rid of diabetes. Apart from pancreas, what other organs are involved? It is liver, skeletal muscles, kidney, brain, small intestine, adipose tissue, and the most important is interstitial tissue. And usually we do not talk about interstitial tissue, lymphatic drainage. What happens? The adipokine dysregulation leads to low-grade inflammation. And apart from that, abnormality in the gut microbiota leads to immune dysregulation. This low-grade inflammation is the key pathophysiological factor leading to converting insulin resistance into diabetes mellitus.
Sir, sorry to interrupt you. Sir, have you slides are not visible?
Do you want me to show the slides?
No, okay. You're showing, otherwise this discussion is also good. Yeah.
Okay. So let's summarize.
Yeah.
Pathophysiology, beta cells are dysfunction, leads to reduced insulin secretion, and insulin resistance contributes to increased glucose production in the liver and decreased glucose uptake, both in the muscles, liver, and adipose tissue. Now, what I was talking about, interstitial tissue, there is a compelling evidence that ATP in the interstitial tissue, the space between the cells, is an important regulator of beta cell function. And here comes the role of naturopathy, Abhyangam, hot and cold therapy. What in naturopathy say? 2 minutes hot water, 1 minute cold water, and putting a thandi patti, garam patti. Here is the role of having a shower. I'll be talking about in detail. Western diet is again an important precipitating factor because due to high VLDL, there is a spike in reactive oxygen species. And this reactive oxygen species leads to low-grade inflammation. And this low-grade inflammation repeatedly leads to your insulin resistance, mitochondrial dysfunction. And if there is a dysfunction of the mitochondria, your glucose metabolism is disturbed. Another important cause of diabetes is gut dysbiosis. What gut microbiota is doing? It leads to immunity, it leads to inflammation. Hence, gut dysbiosis has to be taken care of because it regulates the integrity, human metabolism, and it releases synthesis of various metabolites, including serotonin. This dysbiosis can promote insulin resistance and leading to diabetes. What is important? This dysbiosis leads to reduced short-chain fatty acid synthesis. I repeat, this dysbiosis leads to reduced production of short-chain fatty acids, which promote gut barrier integrity, pancreatic beta cell proliferation, and insulin biosynthesis. Even just taking care of abdominal flora, gut microbiota, we can reduce the incidence of diabetes. Again, I was talking about Western diet. High-fat diet induces up to 3-fold polysaccharide from gram-negative bacteria, which leads to low-grade inflammation and insulin resistance. Avoid keto diet. Now, there is a lot of publicity about keto diet. What is bad in the keto diet? You are having lot of fats, and this leads to low-grade inflammation, number one. Number two, it leads to further central obesity. And this is one of the keto diet is one of the cause of coronary artery disease. There is one molecule synthesized from the skeletal muscles and adipose tissue termed as irisin. Irisin has derived its name from Iris. Iris is the name of a goddess from Greek. What happened? Due to exercise, whenever your muscles are active, there is a release of irisin. And when the level of irisin goes down, that leads to inflammation, and that precipitates insulin resistance and diabetes mellitus. Again, how we can promote secretion of irisin from the skeletal muscles? By extreme temperature, means extremely hot shower, then extremely low temperature shower, and resistant exercise. I'll be talking in detail about resistant exercise. My whole theory is based on resistant exercise. If you go for resistant exercise, you can cure diabetes. And again, it's vibration. Vibration in the form of hectic dance, a vibration in the form of any activity where there is a lot of. I just want to mention what you mentioned, the name of Tulsi. Tulsi is a molecule which takes care of the irisin production. And if you are taking Tulsi in your diet, it increases the production of irisin, and perhaps you can control some of the diabetes by that. Whenever you control your diabetes by multiple drugs or single drug, body remembers it. This is called metabolic memory. And what is behind it? That is oxidative stress, chronic inflammation is there, and up to some time, up to maybe even up to months, you have a controlled diabetes, but in the background, you are having side effect of diabetes and complications. But if you control it properly, it takes months together, but you can get reverse of diabetes and its complication. So I was talking about mitochondria dysfunction. Mitochondria main function is to release ATP by oxidative phosphorylation in response to metabolic demand. Whenever there is an imbalance of energy intake and expenditure, it is due to mitochondrial dysfunction. And here is the basic pathology which leads to production of reactive oxygen species. And what we advise, we say to take antioxidants. Apart from taking antioxidants, we have to manage the function of mitochondria by proper pH of the body, enhancing the plasma membrane permeability by extended deep abdominal breathing. And this deep abdominal breathing leads to better functioning and control of free radicals. And when these free radicals are there, it leads to insulin resistance in the skeletal muscles, lipid, and various organs. Insulin resistance leads to diminished insulin secretion by beta cells, insulin antagonist in the plasma. So what we have to do, we have to check insulin resistance by exercise, by hot and cold shower, by Abhyangan means massage. Glucocorticosteroids is one of the key factors which leads to muscle catabolism, gluconeogenesis and lipolysis. And how the glucocorticosteroids is released? By stress. Whenever your pulse rate is more than 80, whenever you are disturbed, when you have got a rapid shallow breathing, when you have got a paradoxical breathing, that is the time your body secretes glucocorticoids. Means you have to calm down, you have to be comfortable to decrease the release of glucocorticosteroids. And one more important thing, life, there will be stress, but it's your part to change your stress into eustress at place of distress. Whenever you go into the distress, then glucocorticosteroids will be released. When you will be go into eustress, it will be challenging and your body will support you. I repeat, the main organ for insulin resistance are skeletal muscles, adipose tissue, liver, interstitial tissue, and mitochondria. So we have to focus on mitochondria, skeletal muscle, adipose tissue, and liver to get rid of diabetes mellitus. In the skeletal muscle, it is the most important organ after pancreas. Apart from exercise, which exercise? Resistant exercise. Means by simple walking, you cannot cure diabetes. You can, yes, with walking, you can lower down your glucose level, but you are not going to cure your insulin resistance or increase production of insulin. Another factor, you have to go for resistant exercises. Other factors which are important, air conditioner. Skin sends a signal to the brain. If your room temperature is below 24, body goes into defense. If your aroma is not acceptable to your body, a signal goes to the brain. Again, a social environment. Your friend, your circle is important. And being a ENT surgeon, I'll say noise. Noise is a very important factor to lead to stress. A sound above 90 dB is harming. If you are enjoying DJ, If you are in a high volume sound, remember this precipitates stress and this enhances your insulin resistance. So a diabetic has to avoid noise. How it works? Muscle works. Physical activity increases blood flow, enhances glucose utilization. Again, obesity. What the obesity is doing, it is leading to a low-grade chronic inflammation in the muscle, and this lowers the production of your irisin and leading to impaired myocyte metabolism, leading to insulin resistance. So if you do exercise and you are having central obesity, you are not going to win. Hence, both the things have to be taken together. Adipose tissue, fat. It is just not a fat. It is a metabolic dynamic tissue capable of synthesizing wide range of biologically active compounds. It leads to homeostasis. It leads to coagulation, angiogenesis, fibrolysis, and some of the colleagues are from IVF. It affects your reproduction also. It takes care of your vascular tone, appetite regulation, and body weight homeostasis. So adipose tissue and skeletal muscles are two important parts to control. And for adipose tissue, naturopathy, abhyangam, it means body massage, is a very, very important part. When insulin acts on adipose tissue, it stimulates glucose uptake and triglyceride synthesis. Suppressing triglyceride hydrolysis means you will be having simultaneously more fat. Another organ which is important to understand is the liver. In the liver, insulin does not only regulate glucose beta production and utilization, but also affects lipid metabolism. So in the liver, there is a glucose metabolism, lipid metabolism, and broadly, there are multiple metabolic processes. And in physiological state, liver controls your glucagon and glucose, both of them. And hence, we have to have a healthy liver. Dr. Ritu was talking about HB1c. Ma'am, as the name implies, HB means hemoglobin. Whenever your hemoglobin level is down, the glucose molecule will not be attached to hemoglobin. Hence, there will be hyperglycemia, means there will be more sugar in the plasma. And this will lead to insulin resistance. And the simple way is to correct your anemia. And if your hemoglobin is more than 14, you win 30% of your war against diabetes mellitus. Thank you. I'm not talking about various complications like atherosclerosis, peripheral vascular disease, foot disease. So once we take care of diabetes, we will not be having any complications. I was talking about mitochondria. What mitochondria is doing? It's producing energy. And if your body knows how to control your basal metabolic rate, after the age of 30, your muscle mass, your basal metabolic rate, means your skeletal muscles, and your basal metabolic rate goes down 10% every decade. That is the reason after the age of 45, 50, you get diabetes, because your basal metabolic rate has gone down. You are not consuming energy. Your muscles are not consuming energy. And simultaneously, your muscle mass is going down. So we have to find out the factor which affect our basal metabolic rate. Muscle burns calories rapidly, while Calorie burnout by the fat is sluggish. So with every decade, we add 10% fat in the body and we decrease 10% muscle in the body. So this we have to reverse this ratio. We have to go back to the original state of muscle mass and reduce belly fat. Again, when you eat food, when you digest food, when its metabolism takes place, that is the time your basal metabolic rate rises. Who gets diabetes? A person who takes a breakfast at 9 o'clock, goes to the office and working 6 up to 6 p.m. without food or having just coffee. That is the reason of low BBR. After 4 hours, principally after 5 hours, your basal metabolic rate goes down. We have to maintain this basal metabolic rate. We have to take food every 4 hourly, preferably 3 hourly. It is said in the for a diabetic to have food every 2 hourly, 3 hourly. Why? To maintain, apart from maintaining, having a sustained level of glucose, you have to a better BMR. So if you are taking a food every 4 hourly, your basal metabolic rate will be maintained. Other thing, important thing, having low calorie food, giving a signal through the stomach to the brain that you are getting food, body is getting food and your BMR is maintained. Take low calorie food every 3 hourly and give a command to the brain. So what is the muscle mass percentage? Average, your lean muscle is 70%, maybe 90% in athlete, and body fat is 10% to 30%, which gets down with the age. So I was talking about two things. One was working the mitochondria. Second was metabolism. If you are earning 1,000 rupees and expenditure is 2,000 rupees, you will always be in loss. So if your intake is less than expenditure, for that you have to enhance your metabolism. How you can enhance? Eat plenty of proteins at regular interval in every meal. Second is drink more water and slightly more water. In Ayurveda, what is said, Vata Pitta Kapha. After the age of 45, 50, your Vata predominates, and what is predominant is more with the cold water, more with the cold weather, more with the stress. So drink slightly warm water. Do a high intensity workout. High intensity workout is the key. When you do walking, your basal metabolic rate rises for 4 hours. And when you do a high intensity workout, your metabolism rises for 48 hours. And this high intensity workout leads to growth hormone production also. And again, which adds up into your metabolism. To do a high intensity workout, lift heavy things. Need not to go to the gym. What Lord Krishna has shown, what Lord Hanumanji has shown, they had a gada. And just do a exercise by gada, mudgar, or simply a dumbbells can do this job. And whenever you are working in your office, stand up often. I'm lucky, I'm a ENT surgeon. I sit on my chair for 3 minutes, go for the examination and come back. Drink green tea, eat spicy foods. In the spicy food, after the age of 45, you have to be careful about Vata Pitta combination. If you take a lot of spices to control your metabolism, you may develop gastric ulcer. So understand your body, understand your needs, and eat spicy foods. Cinnamon is one of the best. Cinnamon increases your basal metabolic rate and get a good night's sleep. One thing I want to tell you, the secret of my life also. always appreciate your friends. Always appreciate your life partner. That makes your life comfortable. The way you can live without disease. If your association is good, if your aura is good, if your environment is good, if you have got a support from your friends and family, you will not get any sickness. Apart from that, I'll be talking about how to take shower. Whenever you go for the shower, before going to the shower, do a dry friction by a dry towel. Then go under the shower, rub your body under the water, use both hands, and then you go a extremely hot, tolerable shower for 2 minutes. Come to the cold shower for a minute, again go for the hot shower and come to the cold shower. That stimulates your skin. That leads to lipolysis. And again, Abhyangam means body massage, leads to better lymphatic drainage and lipolysis. Reduced physical activity, sedentary lifestyle leads to diabetes. So, do a vigorous exercise by weightlifting, by mudgar, by high intensity exercise, or what Lord Krishna has said. Enjoy singing. He has said about Ras Leela. So every evening, after your 8 hours working, enjoy, devote yourself, love everything, and be with the God, enjoy everything, and you will get rid of anything. And whenever your BMI is more than 30, you are at risk of diabetes. And just by 40 minutes exercise, you can control your diabetes, but high intensity exercise is a need to cure your diabetes. For the liver, you can take leafy green vegetables, broccoli, cauliflower, just a simple thing. Leafy green vegetables make a lot of difference, but mooli leaves, radish leaves are extremely good to recoup the liver function, and overnight fasting in 3 months' time can reduce the incidence of non-alcoholic fatty liver disease. Tulsi, neem, and giloy are very good. I just want to share one of a lifetime earning secret. Just add neem tablet. It's cost 1 rupee, 1 tablet. Add 3 tablets per day in any prescription to a diabetic and see the response. Your treatment will be 200 times better. Cure rate will be 2 times better. And the last thing, I was talking about stress. Whenever you sleep, you undergo abdominal breathing. When the baby is born, it's abdominal breathing or diaphragmatic breathing. So you have to learn diaphragmatic breathing. It is soothing to the autonomic nervous system, what we say Ida Nadi. And to soothe Ida Nadi, whenever you are doing Anulom Vilom, you have to remember, right is your Pingala Nadi. This increases your stress level. This is sympathetic. And your left is Ida Nadi is parasympathetic. So if you are diabetic, you have to decide where is 1 unit, where is 2 unit. And if you want to calm down your body, your breathing should be 2 times from the Ida Nadi. It improves muscle function, it increases oxygen level, better lung function, reduces blood pressure. How? Because it acts as a vehicle tool. When you breathe in, your heart rate goes up. When you breathe out, your heart rate goes down. When the difference of inhalation and exhalation is more than 10, means your vagal tone is good and you are not going to have sickness. Whenever you are doing humming, that releases nitric oxide. And in corona period, we have been talking a lot about nitric oxide. Low nitric oxide level leads to insulin resistance and poor functioning of mitochondria. John Hopkins Institute, Mr. Abbey said, that humming releases nitric oxide, which leads to lipolysis, insulin sensitization, higher basal metabolic rate, enhanced vagal tone, which reduces heart rate. So just by humming, and if you involve humming spiritually by chanting Om, so you will be having multiple-fold advantage of humming, releasing nitric oxide. And nitric oxide is also helpful in infertility also. It leads to lipolysis also. It controls thyroid function. And when you are doing humming or Om chanting, there are three components of Om: Akar, Ukar, and Bakar. Akar is for Muladhara Chakra, Ukar is for Anahat Chakra, and Makar is for your Vishuddhi Chakra and Ajna Chakra. And you can control your thyroid function. If you are hyperthyroidism, you have to do low frequency humming. And whenever you are having hypothyroidism or you want to shed off weight, you have to do high frequency Brahmi. I will give you a second. This is for hyperthyroidism. Okay. And when you want to go for hypothyroidism, then it has to be high frequency. So with each frequency, you can regenerate each chakra of the body. So let me complete. Resistant exercise, overnight fasting, body massage, and for the microbiota, enema, modified diet, Vasti, and people talk about a lot of exercises, but two exercises are extremely powerful for diabetes. One is Agnisar, second is Viprit Karni Mudra. And if you do just humming and evening dancing, vigorous dancing, then nothing is required. And what Lord Krishna has said is Prasran Kratva Bahir Bahijan Chakshu Chavantare Bhavo Prano Pano Samo Kratva Nasa Bhyantar Charino Yatendriye Manobudhir Murni Moksh Parayana Viktecha Bhai Krodo Yasada Mukt Evam. Calm down, relax, focus your eyes on solar plexus, Ajna Chakra, and do humming. Nothing is required. You will have a healthy life. Thank you very much.
Thank you so much, sir, for such a wonderful presentation. Sir, you have cleared a lot of doubts what everybody is having. So meanwhile, first I welcome all the delegates who have joined. I can see some of the friends here, Dr. Shabina from Mangalore. Yeah, Dr. Aparna Godbole is my dear friend from Pune only. Dr. Rekha Gupta, warm welcome Rekha ji from Kanpur. She's Renu Bhatia madam is also from Kanpur. Welcome. And so many other friends. I am able to see, yes, Dr. Hema Kothavle from Miraj. Yeah, warm welcome, Dr. Hema. Yeah, hello Dharmenji. And Lima also I can see a dietitian from Bangalore. Yeah, so many other friends have also joined. Sir, thank you so much for enlightening. So, sir, I want to know some queries are there. Sir, as our topic is related to the diet which refers to diabetes. Sir, what about your opinion for related to this mango? This is the mango season. So everybody is having lot of doubts related to mango and diabetes. I want that you should clarify on this platform.
Look. First thing, what Hindu mythology and Ayurveda says. सीजनल फ्रूट्स हम हिंदी में फल कहते हैं
जी,
फल कभी भी हार्मफुल नहीं हो सकता. So fruits are never harmful, but you have to take them in optimum quantity. A mango is a wonderful fruit. One can consume it, but he has to manage the calories. If you manage your calories intake per day, nothing is bad in it.
great, great.
One thing I would like to add. Chlorophyll has got a property to detoxify body. If you simultaneously, if you add chlorophyll in your diet, perhaps you can take anything on earth.
Yeah. That's great. That's great tip, sir. So means along with the mango, any kind of the green leafy vegetables, if you can include, that will be much, much better. Sir, what's your opinion regarding the mushroom and diet? Because lot of diabetic diet. Is it any studies are coming that some studies that the intake of the some kind of the mushrooms also help in the reduction of this elevated sugar levels?
There is. But I prefer doing a resistant exercise which can cure a disease. Why to take linger a disease and go with it? Just do a resistant exercise 30 minutes a day for 3 months, and in 3 months time you can convert your 3 kg fat into 3 kg muscle, and lifelong you do not require anything.
Okay, thank you, sir. Sir, there are a lot of compliments we are getting. Yes, the first is from Dr. Ajit Dangi. Is a brilliant webinar. Dr. Ajit, you have joined from where? From which place you are? Yeah, Dr. Rekha ji is writing. Rekha is our senior from Kanpur. Awesome lecture, and she's congratulating. Yeah, again, Dharmen ji is writing. Thanks, ma'am and sir. Dr. Shabina is writing. Good lecture. Again, from Dharmen ji, again a compliment. Awesome session. Again, a question from Dr. Shabina. She is writing, could you please recommend a good brand of chlorophyll and spirulina?
Look, I say spinach is one of the best. Take spinach, clean it, make the slices, and put it in a mixie and take a smoothie.
Okay. Great, sir. Again, the compliment from Renu madam. Renu madam is a very busy practitioner from the Kanpur only. Renu Bhatia madam, yeah, she is also writing the excellent talk. So thank you, Renu ji, also for joining. So besides, there's a lot of appreciations we are receiving here and there. So thank you once again.
There was a question. What are resistant exercises?
Yes,
do you want me to answer it?
Yes, sir, please.
I said any exercise, push-ups are one of the best exercise. Push-up is one of the best exercise. Second is your dumbbells. Third is going to the gym and doing resistant exercise. A very important, which is not talked usually. If you are doing a resistant exercise for less than 30 seconds, particular exercise, then it is called dynamic. And if you are doing it for more than 30 seconds, then it is called static. And static is going to enhance the muscle mass, and this static is going to give you 48 hours increased BMR. Means if somebody is doing hurriedly, no, hold with the resistance for more than 30 seconds. That is more important. It's not 5 kg, 2.5 kg or 15 kg. It is more holding for more than 30 seconds. That is important.
Thank you, sir. Rekha ji, you can unmute and ask your question. Welcome, Rekha ji. And Renu ma'am also welcome. Renu ma'am also wants to ask some question. Yeah, Rekha ji, first you can ask. Yeah.
Thank you. It was wonderful. Like, I think we are lucky we heard this lecture. Sir's lecture was so different. So thanks a lot, sir and Dr. Ritu. We really gained from it. And I wanted to ask that, sir, you were telling us about one nari that like if you have to prevent diabetes or you want to cure diabetes, then one nostril, the which one has to be from which one we have to do the breathing?
Look. I'm not saying which nostril you have to do. Ida Nadi calms down your body. If you have to be comfortable, breathe through the Ida Nadi. If you have to do a act where a lot of energy is required, that it is a Pingla Nadi. This is a solar, sun. This is moon. Moon calms down your body. So Pingla and Ida are two different nadis. And when you do not breathe, then Shushmana is activated. So in yoga, what we say, hold the breath. And when you hold the breath out, then we say Vayukumbhak. And in the stage of Vayukumbhak, your body recoups best. That is what yogi do. 1 unit inhalation, 2 unit exhalation, and holding the breath out for 4 units. Gradually, you have to practice it.
Okay. Thank you, sir. So it's not about like closing one nostril, which is more important, nothing like that, na?
Yes, it is important. It is important. What you want to do, that it depends on that. If you want a better digestion, your left nostril has to be up. Okay. You have to lie down on right nostril posture for 10 minutes. You can change your comfort level. You can change your thinking by just changing the nadi, right, left.
Okay.
I think we will invite sir once
yes,
for having this physical workshop. So that will be great. Yeah, Renu ji, welcome. Renu ma'am, you want to say something or ask question? Renu ma'am, you can unmute yourself and can ask. Yeah,
I'm just doing it.
Sorry, voice is breaking, Renu ji. Renu ma'am, voice is breaking. Yeah, hello, Renu ma'am. Renu ma'am, unmute yourself. Unmute yourself. Renu ma'am, you are muted.
Yeah. Ritu, thank you very much. It was just an excellent, wonderful lecture, and you are always a good moderator. It was very informative, and really we know that yoga and all these physical activities, they are very helpful in diabetes. And Dr. Mahendra Kumar has really elaborated everything very nice. But yes, as you said, the physical workshop, that will be very good if he demonstrates.
Then all of you have to come to Pune. I am going to call the sir in Pune, not in Kanpur, in Pune.
It will be pleasant.
Yes, we can. That's where we can your hospitality also.
Yes, warm welcome. Renu ji, Rekha ji, Kanchan Malaji is also joined. Hello, Kanchan ji. So, sir.
Hello, Ritu.
Yeah, hi, Kanchan ji. How are you?
बढ़िया, एकदम बढ़िया. लेकिन मेरा मिस हो गया थोड़ा सा.
फिर आप रिकॉर्डिंग सुनिएगा. इतना बढ़िया लेक्चर था आज सर का, बहुत ही अच्छा था. If anyone.
It was very nice.
Yeah, very informative. Yeah.
I was joining, but it was really very good.
Yeah. Thank you, ma'am.
Thank you. Thank you, everybody.
Yeah, thank you. Sir, thank you once again. I think we have finished all the queries what we are having today.
Niklesh Gupta is there. Thank you, Niklesh ji, for joining.
Okay. Yes. Dr. Rupali is also writing a good webinar. Yeah, thank you. Thank you, everyone, for joining.
Dr. Ritu, one last question.
Yes, yes, why not, Rekha ji? Yeah.
So, sir, I wanted to ask, like Lom and Lom that we do in our busy routines, is it okay for all type of like we want to just do it in short? So Lom and Lom, if we do, so equal breathing from both the nostrils, is it okay?
Look,
in diabetes or otherwise?
Whether slow breathing is very good. Okay. Whether you do Anulom Vilom Whether you do Brahmari, whether you do humming, the most important is your abdominal breathing. What mistake we commit, I'll show you.
Okay.
What the mistake we do, when we breathe in, our shoulder goes up. It should not be there. It should be just your abdomen. No chest movement. Your diaphragm, basically, what you are doing most of the time, your movement of the diaphragm is reverse. That is called paradoxical breathing. And this paradoxical breathing is the reason for your sickness. But how you compensate it? When you sleep, it is your abdominal breathing. So just if you learn abdominal breathing, then whether you do Anulom Vilom, whether you do Kumbhak, whatever you do, everything is good. Anulom Vilom makes a balance in your sympathetic and parasympathetic nervous system. What is the requirement of the body according to Vat Pitta Kapha? You have to do that.
Thank you, sir. A very, very warm welcome, Tarini Madam, our favorite, our all-time favorite. Tarini Madam has joined. Madam, welcome.
Welcome, madam. Welcome.
Tarini Madam, welcome. We are not able to hear you, ma'am. मैम सर के पास आ जाओ ना, वहीं से बात कर लेंगे. मैम के उधर से आवाज नहीं आ रही है. सर बुलाइए मैम को. नहीं, मैडम की आवाज नहीं आ रही हमको. Madam, we are not able to hear you. Sir, please call madam now, so we won't have blessings also. Without madam, we are able to see but not able to hear. Her phone is not going. I am trying to call her. Madam, good evening and warm welcome.
Hello.
Yes, ma'am, we can hear you. Yes, ma'am.
Yes.
Ma'am, good evening.
Good evening. Very good evening, Ritu. It was really wonderful discussion.
Yes, wonderful
Yes.
discussion. Lot
Yeah.
of doctors have joined, lot of queries. And sir has taken a marvelous lecture, I must say, marvelous lecture. I'm really honored to have a
And you
such.
are doing wonderful work.
Ritu, I was thinking this shows
Ritu,
like
I was thinking this shows like Kapil Sharma
You
show.
remember?
You remember? Everybody, whenever
the
the launch of their movie, they come to that show. So every contestant is joining your show, going before their election, you know.
Because sir's lecture was very nice. Thank you, ma'am. Thank you. And we are thankful to sir that sir has accepted the invitation. Thank you, madam. Thank you for joining. Friends, those who are not aware, Tarini madam is the chairperson of the Delhi SAR and awarded with, she has received a tons of awards. I can't read all the awards. Madam and sir is having the tons of awards, I can say. So we are really blessed to have sir and madam with us. Thank you, madam, once again, and thank you so much, sir. Thank you so much. Thank you, ma'am.
Thank you, Tarini ma'am and sir.
So humble, dear. You're very humble.
It's my pleasure.
Actually listening.
I just forgot to connect.
Ma'am, आपकी आवाज इको हो रही है. Sorry, ma'am.
Okay, dear. Actually, net नहीं आ रहा था. I just forgot. I was listening to Dr. Taneja actually, ना.
आप आवाज बिल्कुल क्लियर आ रही है. आप आवाज क्लियर आ रही है, मैम. हाँ.
Okay. So your show is really rocking.
Thank you, ma'am. Thank you so much. Thank you so much.
It's not in India, it's all over. Internationally,
Yes.
it's very demanding.
Yes. Lot of, yeah.
So good. See you in the next show. Okay?
Sure, ma'am. Thank you once again, sir. Thank you once again. With this, we are winding up, friends. today. And on the next week, on the 9th May, we are having Sheila Tanna is with us. I requested her to change her topic. Actually, she told me she will discuss with the menopause and diet, but I think I will tell her to discuss regarding the diabetes and diet as a lot of queries. And on the 10th May, we are having Dr. Fauzia Hassan all the way from the Bangladesh. She is going to discuss with us about the ovarian tumor and pregnancy. So friends, please stay tuned with me and keep updating your knowledge, as knowledge always increases by sharing. You will get all the links and details on my social media. So do connect with me on the social media, or you can say follow me on the YouTube, Instagram, and LinkedIn. Stay connected. Bye-bye. Good night. Thank you, Sahiti. Thank you, Monica. Thank you, Shield Health team.
Thank you, ma'am.
Yeah.